Let me know when you're ready.
Ready?
Ready?
And I'm rolling.
Welcome to the Kolender Medical Radio Show with Dr. Brian Kolender, MD. Dr. Kolender is a board-certified internal medicine physician who specializes in the assessment and treatment of artery disease. His medical practice is dedicated to the prevention of heart attack and stroke. This show is brought to you by Kolender Medical. I'm your host, Anne-Marie Cronin, and we are going to talk to Dr. Kolender about his unique personalized concierge practice and his plan for revolutionizing healthcare. His vision focuses on preventing the events that lead to all the catastrophic diseases of our time. Dr. Kolender will explain to us about how and why we develop chronic systemic disease and the course we ought to be taking to prevent it. To find out more about how to avoid diabetes, Alzheimer's, heart attack, and stroke, stay tuned and we'll be right back after this short break. So what am I coming back to starting with?
We're just going to talk about prevention and COVID.
Okay.
Just knowing what your health is and having your profile recognize, what you are.
Okay.
Because all these people having problems don't know there's, if you want to tell a
Yeah.
short version of the story, because the bottom line is that guy was sick, he just doesn't know how.
Yeah, but I think you should start with what prevention is all about. Yes?
Okay.
Why is prevention important in the time of COVID, right?
Yep.
Ready?
And rolling.
Welcome to another edition of the Kolender Medical Radio Show. I'm your host, Anne-Marie Cronin, and we are here talking with Dr. Brian Kolender, MD, board certified in internal medicine and specialist in artery disease. Dr. Kolender is here with us explaining his personalized concierge practice and the model of the relationship you ought to have with your primary care physician. He'll also tell us about the simple tests that are available and necessary, which help with the prevention of heart attack and stroke. For more information, we're encouraging you to only call Dr. Kolender directly at 866-KOLENDER. Dr. Kolender, all of your shows are very informative. I don't know what we'd do without you, to tell you the truth. But for the listeners, tell them, what is the connection? We're still in a time of COVID. What is the connection between the practice of prevention and how we get through it in the time of COVID?
Well, thanks, Anne-Marie. It's more important now than ever to kind of take a step back, and we've not had this conversation in a long time, but take a step back and recognize that prevention, building your own immune system, is the best defense you have against COVID or whatever other virus comes our way.
Well, we have a lot of discussions all the time, both on your live show on Thursdays at 7 p.m. weekly, where patients can call in, certainly, and on the Sunday afternoon, 3 o'clock show. We have all kinds of discussions about what people don't know. And I think that people don't know what their profile is. They've never been told how safe they are against COVID or how well their immune system is working for them. How would the average person know? Of course, it's better to be immune to a disease, but how do you know what your immune system is and how do you build it up?
Well, when COVID started, we were having these conversations, but unfortunately the conversation warped into vaccination versus not being vaccinated. So I think it's important to take the step back, go back where we were a year ago and say, we need to know what's going on because COVID generates an inflammatory response. And all along we've been educating you that vascular events are the result of out of control inflammation. And so understanding where you are in terms of this inflammatory process so that you can control your specific drivers of disease will, in the end, protect you against, again, COVID, shingles, the flu, anything that comes your way.
How do people know when they have an out of control inflammatory situation? I mean, most people don't know. You don't have a symptom for that. It's not like if you have inflammation, you don't feel unwell. You have inflammation, people don't know at what level they are or what they don't have any idea of where they're at to begin with.
No, they don't. And when you hear these stories about people who are healthy, no prior diagnosis, no pre-existing condition, getting COVID and dying quickly or going right on the ventilator, I would say that that person had an underlying inflammatory condition, did not know their profile, and so they had no knowledge that they needed to work harder than somebody else to make themselves healthier. Then you get this, virus, and it really puts you out of commission. So to me, again, it's not a question of, it's too simple to say, well, you're vaccinated or not vaccinated. It's where is your health? And that's what needs to be addressed aggressively. And so there's no way for anyone to know, to answer your question, what their inflammation status is, because nothing about the labs, the blood work, the testing that's being done in your doctor's office, if you go to a regular doctor, gives you that information.
So when someone gets diagnosed with COVID, they really have no idea how well they're going to be able to fight it off.
No, and that's why, if we're going to apply the principles of prevention to COVID, if you get COVID, identifying the disease is the most important thing. So we always talk about identifying the disease for heart attack and stroke prevention and dementia. That means identifying whether or not you have plaque. We don't start treating COVID until it's identified. So nowadays, it's you get sick, get tested, identify that you have it so that you can go down the path of aggressively treating it right away.
And how do they aggressively treat it right away? Because I would imagine that most people will just decide to go to urgent care or they'll decide to go to the hospital. Where are they going to go? If they get sick on the weekend, their doctor's office is closed.
Well, to be honest, these days, urgent care is the right place to go. I would not go to the hospital because urgent cares now have rapid testing. They've got PCR testing for COVID, and now they've got the ability to administer monoclonal antibody therapy. So it's much
Is
easier
that
to,
true of all urgent care
no,
places?
not all of them, but
So you need to find out when you call, or you need to find out beforehand if you're going to an urgent care place whether they have that treatment available if you test positive.
I think you should find out where you're gonna go before you test positive.
Right.
You need to have a plan. What happens if I get COVID? Because as you've already said, Anne-Marie, you're gonna call your doctor doesn't pick up the phone. Frankly, if you have COVID, that means you can't go into the office.
Can't go into the building, never mind the
Right.
office.
So COVID, you're a pariah, and now no one will even look at you or talk to you, and you need treatment that day. So
It just reminds me of the biblical days of leprosy, for God's sakes, doesn't it? I mean,
it's
that's
kind of what it is.
yeah, I mean, it's like if you're a leper, you go and live with all the lepers, but at least you're not dying within a week or two.
Well, we've always said that this, social distancing, testing, that's a medieval, medical plan. That's medieval public health. And here we are, 2021, 2020, and that's what we're practicing, medieval medicine in the age of COVID.
And going into our second year of this, no farther ahead. Let's come back and talk some more on the other side of the break. You are listening to the Kolender Medical Radio Show. And if you're interested in finding out more about today's topic or why you should be engaging with a personalized concierge practice, please only call Dr. Kolender directly at 866 Kolender. Again, that number is 866 KOLENDER. You're listening to the Kolender Medical Radio Show on News Talk 760 WJR. Welcome back to the Kolender Medical Radio Show. I'm your host, Anne-Marie Cronin, and we are here talking with Dr. Brian Kolender, MD, board certified in internal medicine and specialist in artery disease. Dr. Kolender is here with us explaining his personalized concierge practice and the model of the relationship you ought to have with your primary care physician. He's also going to explain the simple tests that are available and necessary, which aid to the prevention of heart attack and stroke. For more information, we're encouraging you only to call Dr. Kolender directly at 866 Kolender. Dr. Kolender, let's come back to, obviously, we're still in the time of COVID. What is the person to do if they feel that they have the symptoms? So many people might get sick, might start to have symptoms of COVID on a Friday night, a Saturday morning. Doctor's office doesn't open till Monday. You're not getting in anyway. So what do they do?
Well, you got to get tested right away. That's the most important thing. So, because you need to identify your disease. Now, what do they do if they can't get a hold of your doctor? I mean, I would go to an urgent care because now monoclonal antibody therapy is available. But ideally, you call your doctor who's going to put you on an early treatment plan. And as you've been so kind to point out, that we've been treating, up to 100 people in our office. And again, I have a small practice.
Yeah, but
Small,
none of your people ever went into the hospital, ever went on a ventilator. So they all survived. They all got better. They all got over it, regardless
right.
of their age or the state of their health or their pre-existing conditions. So obviously you are able to shepherd them and mentor them and treat them. And so I guess the answer here is don't go to the hospital.
Well, hopefully everyone who's listening will have a doctor who's going to take the call early and put a plan in place to treat people who have COVID, help them find and get into an infusion center to get their monoclonal antibody therapy on day one. So, back, even before COVID, we would hold off using antibiotics because we don't want to generate antibiotic drug resistance in people. We use a lot of Z-Paks and amoxicillin and ampicillin. And so we don't want to use antibiotics because we develop drug resistant bacteria. Now, though, I want to know right away. This is like the opposite. I want to know right away so that we can start you on a program, mostly supplements. I still promote and prescribe hydroxychloroquine, and then get patients into an infusion center right away. I might even continue the hydroxychloroquine past the infusion time for a few days or longer, depending on the person. And of course, also, we're using steroid inhalers, which are maintenance medications for asthma. There was a study that strongly recommended using inhaled corticosteroids because they benefit people with COVID.
Well, the point is that that Molotov cocktail that you're giving to each individual patient within your patient practice with the patients you have, you already know where they stand. You know where they're at on the spectrum of how well are they or how sick are they or where do they actually stand as far as how much inflammation they have. But the average person out there probably has no idea whatsoever. And I think it's really important to let people know that they ought not to think that they're just going to, get in their car and have someone drive them to the hospital because they're not going to get treated at the hospital. And I think that's why so many of them wind up on ventilators and don't get out.
Well, unfortunately, the treatments in my practice that work the best are not indicated for in-hospital use. So there's no way you're going to get hydroxychloroquine at any hospital. And frankly, most doctors won't prescribe it. And
Okay,
I
I'm going
found
to
it,
stop you there. What do you mean by indicated? What do you mean by it's not indicated for hospital use? Doctors are practicing inside the hospital. When you get admitted into the hospital, you're seen by a doctor. Why can't the doctor give you whatever he thinks is the best treatment to give you to help you get through this and to actually cure COVID as opposed to just supporting it until you cure yourself? Because it seems like that's what's happening in the hospitals.
well, I agree with what you just said 1,000%, which is the doctor should be able to write and prescribe whatever they think is beneficial for their patient. But
So what
when
does this mean? It's not indicated in the hospital. It's indicated in your practice. Why is it not indicated in the hospital?
Well, it's political. And the political nature of it is that back when COVID started, people that were being treated for COVID were exclusively being treated in the hospital. And the people in the hospital were sick, critically ill. And hydroxychloroquine does not work in that group of people. It just doesn't. But Henry Ford Hospital spearheaded a study using hydroxychloroquine as a preventative therapy. And as soon as that study was published, it was lambasted in the scientific news. So right away, that the results of that study were buried and considered horribly done. And so only one study, which is the Henry Ford study, showed there's a benefit to early use of hydroxychloroquine. Every other study showed that it was bad. And of course, President Trump was all gung ho for hydroxychloroquine. So the
Well,
media,
he got it, didn't he, when he got sick?
he was probably taking it every day.
Right.
And so because the Henry Ford study said that's what you should do to prevent COVID. Well, the political nature of this medical problem, which is a terrible thing to have to say, made hydroxychloroquine to be specifically outcast by the FDA to say, do not use this drug for COVID. And I've been using it on every single patient I have
Now, why
for
would they
COVID.
say, why would the FDA say don't use it when you're proof positive that none of your patients wound up in a ventilator, none of them died, and you treated them with hydroxychloroquine?
Politics. That's it. Politics.
So what's the average?
Well,
I mean, people don't
well,
people tend to think that hospital's the all-time savior. You know, if I get
not
really
now.
sick, I know that's
Yeah.
the sad reality is that it isn't. And so they're locked into a situation that if they get sick and they go and get tested wherever and they test positive, it's like big question is what next? Because they're not going to be able to get through to their doctor. They might not be able to get into the building. And having to answer that questionnaire, have you been around anyone who has COVID? No, I've got COVID. Then what do you do? And so they have no alternative but to run to the nearest hospital. And running to the nearest hospital
It's too late.
doesn't mean that you're going to get out.
Well, if no one is educating patients about what to do in the first days of COVID symptoms other than you and me.
Right.
So there's nowhere for people to turn for this information specifically about what to do. And one of my patients called me today that he got tested positive with COVID and he's diabetic and he's not in the greatest shape, but it doesn't sound like he's doing that badly because I talked to him. Someone gave him a litany of supplements, some of which I recommended, some of them I told him not to bother with. And just for the listening audience, I think it's very important that everyone takes vitamin D3. People should be taking zinc. And if you get sick, I recommend adding quercetin, which is another supplement, along with vitamin C at 2 to 3 grams a day. That's 2,000 to 3,000 milligrams a day. So right away, I put my patient on 3 prescriptions: hydroxychloroquine, a Z-Pak, and the Pulmicort inhaler, which was a steroid inhaler we talked about last segment or this segment. And so he's getting those things. And the next thing I said is, let's get you into a infusion center. So I sent him a link to an infusion center finder, and he texted me back. He said, well, I'd like to go to Beaumont. So he says,
Why would he want to go to Beaumont? They don't do it there.
well, they do have an infusion center. Well, in theory, this is what happened. You won't believe this.
I'll believe
So
it.
I need to call to get the referral form to send it in. So they don't tell him that. They just tell him to fax the form. Well, I don't have the form because I'm not on the Beaumont electronic health record. So I called to get the form. I mean, my 4th call, I get through to somebody only because I said I got hung up on 4 times. Don't hang up on me. I need this information.
Mm-hmm.
They told me that they're only doing 5 infusions a day, maybe 10, and there's a 150-person waiting list.
Oh my.
Now you have to get this treatment within 7 days. How is that going to happen when there's a 150-person waiting list?
I don't know, but I think that we need to come back and talk about why the hospital is not providing this service when that's what they're there to do. Let's come back on the other side of the break and talk about this more. You're listening to the Kolender Medical Radio Show. If you're interested in finding out more about today's topic or why you ought to be engaging with a concierge practice, please only call Dr. Kolender directly at 866 Kolender. Again, that number is 866 KOLENDER. You're listening to the Kolender Medical Radio Show on News Talk 760 WJR.
start every show.
Welcome back to the Kolender Medical Radio Show. I'm your host, Anne-Marie Cronin, and we are here talking with Dr. Brian Kolender, MD, board certified in internal medicine and specialist in artery disease. Dr. Kolender is here with us explaining his personalized concierge practice and the model of the relationship you ought to have with your primary care physician. He's also going to explain the simple tests that are available and necessary, which aid to the prevention of heart attack and stroke. For more information, we're encouraging you to only call Dr. Kolender directly at 866 Kolender. And listeners, before we come back to talk to Dr. Kolender some more, I'd like to encourage you all to tune in at 7 p.m. Thursday evening following Mitch Album. We are live. We're the only show in the country that has live call in, talk to the doctor directly. If you have concerns about your own health or the situation that you find yourself in, not getting answers between 7 and 8 p.m. every Thursday, we are live. We're encouraging you to call in, tune in 7 p.m. Thursday night. Dr. Kolender, let's come back and talk a little bit more about this patient that wound up going to Beaumont, or you tried to get him into Beaumont.
Well, I tried to get him in to do an infusion of monoclonal antibody therapy, which is the state-of-the-art treatment to keep you out of the hospital if you get COVID. So I'm calling and I was aghast to learn that they're only doing 5 to 10 infusions a day. They've got a 100+ person waiting list for treatment that has to be done within 7 days. That means if no one else calls, half of the people on that list won't get the treatment. That's if no one else calls. So, you know, this is the flagship hospital of the largest hospital system in the state of Michigan. And they are not equipped in any way to provide early treatment services for COVID, which is critical to keep you out of the hospital. I don't even know what to say or how to feel about this other than, you know, utter contempt and disbelief that there's no thought about they should be doing 1,000 people a day. They could do 1,000 people a day. They're doing 5 to 10.
Well, there are outside labs and urgent care centers that are doing monoclonal antibody therapy. So, I mean, they're obviously probably taking the load, but most people wouldn't think about going to an urgent care center.
I got
Most people, I
referred.
think, would go to the hospital.
Well, but that's what they know. This is a hospital-centric area. You know, I've even called some urgent cares and say, "Hey, do you want to come on the show and market what you're doing?" And they don't want to.
Why not?
They're busy enough.
Oh, yeah,
I mean,
you're right. They don't
all
get-
our chairs are full. We don't need the
Yeah.
business. Don't talk. Don't give our name out.
right.
You know,
Mhm.
so they've got all they can handle. The community hospital needs to serve the community and fill the needs that need to be met in real time. And if right now the complaint is keep people out of the hospital and nothing's being done to keep you out of the hospital. In fact, it's like shoveling you into the hospital
To not be treated.
where you can't get monoclonal therapy. So, and you say, why? The answer is it's indicated for mild to moderate COVID symptoms. If you're admitted for COVID, technically it's severe. By definition, you no longer qualify. You're basically on supportive care. It's
So-
very frustrating. I just cannot, I've not been able to understand what's going on here for the last 3 months since the Pfizer vaccine became approved by the FDA. And I still cannot. And I just want to reiterate that I've tried to prescribe my patients this corticosteroid inhaler for asthma for my COVID patients, and the pharmacies are billing them $1,000 for something that should be a $20 copay, or they ought to be able to pay cash for $50. And it's $1,000. Why isn't the FDA providing an emergency use authorization for that kind of drug?
Yeah, and why isn't it?
Because they want you to get vaccinated, period. That's their
Well, yeah,
plan.
but once you've been diagnosed with the disease, you're now a danger to yourself, your family, and other people,
I understand.
and that you're helping the spread. and we're getting nowhere near herd immunity. So I mean,
It's the
that's not a very
optics.
smart. That's not a very smart answer.
It's
Like, this is a way. If you have to pay $1,000 for medication, this is a way to encourage you. You can't backtrack. You have COVID now. You're the getting the vaccination after you've got COVID is kind of counterproductive and ridiculous.
well, if you end up in the hospital, then it's a better story promoting the vaccine. That's why. The vet, because all the whole anyway, we're not gonna we need to talk about what do you need to do, listener, to stay out of this. And the answer is you need to know your profile. Let's get back on track. I'm putting us back on track.
Right.
It's not the live show. So
Right.
we need to tell you that you need to know your health. And what that means is getting testing that identifies your inflammation status. And things that I do in my office are simple imaging and blood work that looks at artery health. And unfortunately, these tests are not being done in when I mean most offices, I'm going to say practically any other office.
Well, because they're not focused on or specializing in prevention. They're basically only there to give you a band-aid and treat what you're suffering from today. And they treat you in primary care. They treat you once you've been diagnosed with diabetes or hypertension or whatever. You have to have the disease, first of all, for them to actually start treating you. But they're not going back and saying you need to. None of them are doing preventative medicine, that's for sure. And it's people are going to have to take it upon themselves to understand that they need to know what may be pre-existing in their body, and they need to get into a prevention practice, of which they're very few and far between.
And I can hear people saying, well, Colender's practice has healthier people. And I want to,
That's not
it's
true.
not true at all.
It's kind
So,
of a ridiculous thought.
well, but that is what people say. When I mention this to other doctors, they go, well, you got healthy patients. And it's not true at all. I've got patients across the board, all ages, all degrees of compliance. And I've had patients, frankly, who did get through COVID really well that I was surprised of, because when you hear a news report of who dies, I'm thinking they just described my patient who survived COVID. And the only thing I can suggest is that they're on a program that's reducing their inflammation, even if they're not as compliant as I would like them to be in their lifestyle. So it doesn't mean all my patients are perfectly healthy. It just means that they are aware of what they should be doing more than anybody else. And they are on a program of vitamins and prescription drugs that they need specifically to lower their inflammation.
Well, I've known of, several friends and colleagues of mine that have joined your practice, and one of the things that I hear back from them is that they like the fact that you start explaining to them what is already wrong with them or what they may already be suffering from, that you're taking a deep nosedive into taking a look with the testing that you're doing that nobody else does, the CIMT and the other testing that you're doing in your office, not available, doesn't happen with other doctors. And that's why some patients are just getting fed up and exasperated because they don't know what's wrong with them and they don't want to wait till they get the disease.
Well, and everything we do is actionable. Like, I don't do a test and go, well, here you are, you're fine. Whatever the result is, there's a goal to either get better from wherever point you are on the spectrum. It's okay, this is as good as it can be. Well, now we have to stay there and find problems that are brewing that haven't developed yet so that you can stay in a good place. Or anywhere on the spectrum is the level of attention we need to put in depends on what we identify as, wrong or off with in terms of your inflammation marker. So this, you mentioned the CIMT, and that's an ultrasound that looks at the wall of the artery, and it looks at the layer of the artery wall where inflammation is. So I tell my patient that this is a visual representation of your inflammation of your artery.
Yeah, and the sad thing is very few people know about that test, the CIMT, even although we keep talking about it on every show. So let's come back and talk some more about what people need to know about their own health and how to be in a preventative practice. You're listening to Kolender Medical Radio Show, and if you're interested in finding out more about today's topic or why you ought to be engaging with the concierge practice. Please only call Dr. Kolender directly at 866 Kolender. Again, that number is 866 KOLENDER. You're listening to the Kolender Medical Radio Show on News Talk 760 WJR.
He's ready.
Welcome back to the Kolender Medical Radio Show. I'm your host, Anne-Marie Cronin, and we are here talking with Dr. Brian Kolender, MD, board certified in internal medicine and specialist in artery disease. Dr. Kolender is here with us explaining his personalized concierge practice and the model of the relationship you ought to have with your primary care physician. He'll also talk to us about the simple tests that are available and necessary, which aid to the prevention of heart attack and stroke. For more information, we encourage you only to call Dr. Kolender directly at 866 Kolender. Again, that's 866 KOLENDER. Dr. Kolender, this is our last segment. Unfortunately, we're still in the time of COVID, and it's really important to people, patients, listeners to know, what do they do? They're out there, they're afraid, they're in their house, they can't get access to their doctor. We're in the time of COVID. What do they need to know about getting into a practice with prevention, and why is prevention so important, and what is the connection?
Well, I'm going to answer your question in a roundabout way, Anne-Marie.
Okay.
So, what are the top 3 type of patients that die from COVID? It's obese patients, diabetics, and asthmatics. So those are the 3 most at-risk groups of people. And in my practice, I don't really care about weight. Like, I don't think weight is a marker of risk. Now, in the traditional sense, your weight, whether or not you're obese, is the number 1 risk marker for you're going to have an event, and not in my practice. And the reason is I'm going to say is I check markers that are much more specific than your weight. So knowing what these markers are is important to make sure that we're healing those markers, not that you're losing weight, because I have plenty of thin people who are not healthy, and I have heavier people that are. So it's not a weight issue. I mean, what do you tell, the obese population when there's basically a epidemic of obesity in our country? Well, you're at risk. Well, you don't think those people have been trying to lose weight their whole lives? And
Mhm.
now I got to lose weight tomorrow, or I'm going to die if I get COVID? No, you need to know what your inflammatory markers are and address those. Those are the data points that need attention. And if you lose weight, you lose weight in the process, great. If you don't, frankly, I don't care. My patients in this that fit this profile, healthy, overweight people, had COVID, they've done fine because we've lowered the markers that matter. It's not weight in my office. It's, yeah, like everyone wants to be thinner and look healthier, but you can be in great shape internally. Your arteries be happy and not lose an ounce. The other thing is asthma. Well, let's go to diabetes, probably the next main thing. So again, your A1C in my mind isn't the end all be all number. It's, are we healing your arteries? Are we reducing your inflammation markers? Are we lowering the measurements of insulin resistance? And if you're a regular listener, we talk about insulin resistance all the time. That's the process that causes diabetes and cancer and Alzheimer's and dementia and Parkinson's, heart attack and stroke. We can reduce your insulin resistance, and maybe the A1C doesn't budge that much, but we're showing all these other marker points are coming down. So on the flip side, I've got patients who have good A1Cs and their inflammation markers are high and their insulin resistance are bad. So it's a matter of checking the right kind of data points.
You know, it's amazing that patients and listeners out there, I'm just thinking about the mass population. They have either 1, 2, or 3 doctors, primary care, 2 specialists, maybe a cardiologist, maybe an endocrinologist, depending upon what's wrong with them and who they've been referred to. And they have an entire closet full of medications that they're taking. But something is basically wrong with this story because I think that in the time of COVID, people are looking for a cure, and that is incumbent on the primary care physician to provide them with a cure and to shepherd them through the process, and that's not happening. So sadly, everybody's just going to have to call you or call another prevention specialist because there is no hope with the primary care physician, if I'm understanding it.
Not in the state, probably not in the Midwest, because the Midwest is like a dearth of forward thinking outside the box doctors. It just
Right.
doesn't exist here. We've lived too long in the age of the golden Blue Cross card, and no one's woken up to the fact that they need outside help. They've got to get a consultant who's outside the system, because the system wants you vaccinated and won't get you treatments that keep you out of the hospital if you get COVID. It's no one's telling you what to do, and if you do figure out what to do, you don't know where to go. So it's really a matter of, again, we talked about knowing what's going on and thinking outside the box of how to get there. Um, the problems people have can be managed in so many different ways other than taking a very potent immunosuppressant drug, to treat their asthma, their colitis, their skin problems. And when you take things on in a natural way, when I mean natural, foundational answers, foundational um, opportunities to fix your lifestyle, eat the right kind of foods for you. Everyone needs a different food prescription, basically. You can improve your inflammation and your immunity that way and not leave you predisposed to COVID, for instance.
I'm
So, yeah.
I'm still thinking there needs to be an overarching principle here that I know so many people have different doctors treating different things. So if you have, you have asthma, you have one doctor. If you have diabetes, you have an endocrinologist. If you have a cardiac situation, you've got a cardiologist. And then you've got your primary care physician. And one doesn't know what the other's doing, who doesn't know what the other's doing. And so these people have nobody that's connecting the dots. And I think that all roads should have to lead back to the primary care physician, someone like yourself who needs to invest more time and effort and energy into looking at the bigger picture and connecting the dots and being responsible if they refer their patient out to a cardiologist or an endocrinologist. Pull the information back and do something, and then let that patient know if you get COVID, here's where you go and here's what you do. And going to the hospital is not an option.
Well, I just want to say that the problem with these specialists that you just mentioned, Anne Marie, which are all, part of the workings of prevention, the dots that they're drawing are in the wrong place.
Mhm,
They're using the wrong data. So I don't care about the labs that the cardiologists use to say you're okay or not.
mhm,
I don't care about the labs that the endocrinologists are using to tell you your diabetes is good or not.
mhm.
I find those labs worthless. They don't tell me what's wrong with you. In fact, they're misleading.
Right.
How many times have we talked about a patient on the show that got a, positive review from their endocrinologist because their A1C was great and they're happy, blah, blah, blah. And, 2 months later, they had a heart attack.
Mhm.
I mean, you know,
Or even the useless tests like the stress test and doing the EKG that
wrong
doesn't
dots,
necessarily
wrong
wrong
dots,
dots
right?
and
We don't need to know those things. You need to know what's your arteries look like, what are the different layers of your arteries, what are the labs that reflect disease activity, and find all of the hidden killers that people have that I need to find them before they show up. And I don't mean to cause you death, but cause you disease. We got to find them and address them when they are asymptomatic.
So, in the time of COVID, when we need more help than ever before, it's incumbent on the patient to find a practice that is going to take care of your entire health. And that's all about prevention. Well, unfortunately, we're out of time, and that wraps it up for the Kolender Medical Radio Show on News Talk 760 WJR, sponsored by Kolender Medical. I'm your host, Anne Marie Cronin, and again, I want to thank Dr. Kolender for talking to us about taking charge of our health, being proactive, avoiding heart attack and stroke, and more importantly, what you can do to halt or reverse the process of chronic degenerative disease. It's never too late to start. For more information on today's show or to learn more about how you can engage with a personal primary care concierge practice, you can call Kolender Medical directly at 866 Kolender. Again, that number is 866 KOLENDER. We hope that you have enjoyed the show and that you've become more aware of your options in preventing and reversing disease. Once again, reach out to Kolender Medical at 866 Kolender, and thank you for listening.